Professor, good morning and thank you very much for your time. Now, this positivity rate has concerningly jumped to roughly around 22%. And what we understand is that the increase is from the two sublineages or subvariants of the Omicron family. But we also know that experts had expected a new wave to be driven by a completely new variant. What do we make of this phenomenon?
Okay, good morning, Fundo, and thank you for having me, and good morning to all the viewers. Yes, it is correct that we have started to see an increase in the number of cases. As you have mentioned, in fact, they are just the numbers from yesterday that have just come in, showing a total number of positives of 6,435. So there is a definite increase in new cases, and we have seen this in the last few days. But at the same time, I always want to remind the public that we've just come out of a long weekend, and so we are only going to see where we really are in the next few days as more testing happens. But there's a definite increase. And also, you are correct in saying the percentage test positive is concerning. It has actually increased very steeply, in that we're now sitting at 23.6% from yesterday's numbers. So there's a definite increase in percentage positivity rates. And thirdly, insofar as the variant is concerned, we all knew that we're likely to get another resurgence in cases. And the question is always, what is going to be driving that? And we do know that in the country, we have got a very close monitoring system that's looking at currently circulating virus. So the genomic surveillance is on this, and so far we still continue to see the sublineage of the same Omicron variant. And right now, what has been identified across all provinces are the same the sublineage, which is the 4 and 5 of the of the Omicron variant. So we have not identified a completely new variant of concern. But as I say, we continue to monitor that. So really, I think where we are at now is we're seeing these increased numbers. The next thing that we are paying very close attention to is what then becomes, the impact on severe disease, and therefore, is there any increase in hospitalized patients? There is a very slight increase that we're seeing. Remember, this often comes, about a week later, after the cases. So there's a close monitoring that is happening, and we need to see whether the current new infections, are they resulting in severe disease or not. We do not expect that, based on the level of immunity that's circulating in the country.
So it suggests that there could be a trend that's developing here, where, like what we saw with the original Omicron, where you see high transmissibility but very low severity, if you will.
Exactly. Yes, that's correct. And that's what we need to pay particular attention to. And maybe just to finish off, in that, yes, there's a slight increase in hospitalized patients, but we have not seen an impact on the number of deaths. So it looks like, but it's still very early days. It's a matter of, giving ourselves, the next 7-10 days to see what happens.
Can you just take me through maybe perhaps the salient differences that you've picked up between the sublineages and the original Omicron?
So you find that, all viruses mutate, and this is evolutionary. As they replicate, they will mutate. So what we are picking up is actually these current sublineages, they have got, different mutations from what was originally identified in the Omicron. And these are very subtle, but we're finding that the areas where these mutations are occurring, they actually are critical areas in the characteristics of the virus, in that they therefore can increase transmissibility. And the other concern is where mutations are occurring in areas that we know have got a relation to, to immunity, whether the virus, the newly mutated variant, is going to escape immunity or not. So really, we are at a stage stage where we have seen these sublineages, and there's already ongoing, intense, studies to see how are those behaving at immunity level. And so we will have these results within a very short space of time. But it does look like there is increased transmissibility. So insofar as immune escape is concerned, it's a matter of looking to see, because once we identify a new sublineage, then the lab people have got to go back and test that new variant or new sublineage against, the existing and the immunity that's already in existence, to see whether there's escape or not.
Then to the provinces that are seeing this uptick, it's Gauteng and KwaZulu-Natal and the Western Cape in particular. What can we really attribute this increase to?
So, just by mentioning those three provinces, as a country, we know those are the most populated provinces. So just sheer numbers in that they are the densely populated provinces. And secondly, what we also mustn't forget is that, remember, whatever numbers we're presenting are driven by testing behaviors. So in provinces where there's high testing rates, we will obviously identify more cases. And so we know that, for instance, whenever you look at our numbers, we know that, without fail, Johannesburg is likely to represent almost a quarter of the numbers tested across the country. And if you combine the three, we're looking at close to 40% at times of the numbers that are tested. So it is really just sheer numbers and access to testing by individuals, which is likely to happen in those three large provinces.
And then on the fifth wave conversation, it seems the minister is not particularly ready to confirm a fifth wave. What are other indicators, or what indicators would one need to confirm that we are indeed in a fifth wave now?
I think the issue here, Mfundo, is, we really have had this resurgence, like 4 waves, basically. Right now, because we are getting into a phase of how do we live with the virus, do we call this a wave, or do we just call it a resurgence of infections? And everybody is moving towards, let's really just look at resurgence of, of infections, because then we don't know. It's going to take a while for us to say, do we then use the same criteria we're using for the last 4 waves to say when we reach about 30% of the previous, infections, then that's a wave, or when we see the number of infections per 100,000. So really, but for all practical purposes, for me, I would say we are now in the resurgence phase. But it is not as steep as we have seen it with Omicron. It is slow. This may be because of the, of the long weekend we've come from. That would be reflecting testing. So really, one thing that every South African must take cognizance of is that we are seeing a definite resurgence in infections. And we need to be very careful into the, when we look at the next few days, how far is this increase going to be, and what impact is it going to have? And then secondly, to bring back the responsibility to individuals and say, this is the time, we're getting into winter now, it's already started getting cold, so we're going to be in closed environments. So it becomes important for people to make sure that you are vaccinated, because at the moment, that is the one, a proven method of prevention that we have. Make sure you are vaccinated. And secondly, when in closed environments, make sure you use your mask and protect yourself. So I think really it's a matter of saying the resurgence has started. We don't know how quickly it's going to go and how far it's going to go. We're monitoring that very closely, but at individual level, people must need to make sure they take that responsibility and protect themselves and their loved ones.
Professor, just speaking on that, bringing the responsibility back to citizens, I believe the 30-day grace period for masks is now coming to an end. So I take it here, like you've said, vaccination is the only key. What other measures could we have in place?
Well, it's going to be important. Right now, if we're getting into an increased number of infections, it's going to be important to make sure that, because we know where there's crowd, where the ventilation is not good, it's important for people to avoid such scenarios. And so it's going to mean where you feel you're getting into a crowded area, we know that masks are protective, and we know that masks work and they work well. And it's going to call for individuals to say, whether they say mask on or not, for me to protect myself and those around me, I want to use the mask. So it's got to come back as health education and how we implement that, more than now relying on the state to say you are forced to be so many, people in a group or not, and to wear masks or not to wear masks. But I think now we need to really shift that back to individual citizens and say avoid crowded areas, make sure that you are in well ventilated areas, and always make sure that when you're wearing your mask you wear it properly to cover both your nose and your mouth, because it's winter, there's flu, there's also, we still are, living with TB, as a country. And so we want to make sure that you can protect yourself against most of those respiratory diseases.
Professor, thank you very much for your time. That's Professor Koleka Mlisani from the National Health Laboratory Services.